Everyone. Welcome back to Talk.Therapy.Heal. You are in for a real treat today. We encourage you just to log on, join in, talk about, process through what you're feeling, what you're experiencing, definitely with a trusted person. Yeah. But join in with us today as we talk about grief.
Hi, I'm Kenya, licensed professional counselor and associate supervised by Ms. Unica Willis.
Hi, I'm Rachel Logan, a licensed clinical social worker.
Hello, I'm Larisha Perlow, a licensed marriage and family therapist.
Hello, I'm Unica Willis, licensed professional counselor supervisor.
Hello, my name is Chantrell King. I'm a licensed professional counselor associate supervised by Unica Willis. So, as it was stated, if you all, first, let me start off by saying this. If you missed part 1 of grief, stop and go back and watch that first, and then come back and watch this one. So it got so juicy good. And we hit so many different angles when it came to grief, and so many things came forward that we decided to do a part 2. We can't just cram it all in one. Mm-hmm. So welcome to part 2 of grief. Make it make sense.
Yes. Oh, that part just really hits right there. Make it make sense, because a lot of things don't make sense. And we as people, we have to give, we try to give everything a purpose, or it has to have a reason. Mm-hmm. And sometimes some things just don't have a reason. It just is what it is because it is. Mm-hmm. Right?
That's true.
But this right here, talking about make it make sense, we're going to do the best that we can to help y'all in making it make sense.
Right.
I feel like in part 1, we got there. And part 2, we're going to lay y'all down.
Right. So grief.
Oh, what are the other types of grief? Because last segment we talked about loss of a loved one. So,
right.
What have y'all seen in y'all practice or in your own lives? What other types of loss are there?
I think there's, I know there's one type of grief, and it's called delayed grief. And this happens when some individuals may experience a traumatic event that leads to death. They don't necessarily deal with it right there in the moment. They're carrying on like nothing is going wrong, and then it hits them way down the line. Mm-hmm. I worked with a young lady at one point that her father died by suicide. Mm-hmm. And of course, the whole family just took it really, really hard. But one of the siblings never said a thing. Went to the funeral, never shed a tear, and then about 8 months afterwards, that's when everything hit that individual. Mm-hmm. And that's when he had to start going through his grief process. So that's one example of delayed grief. Some individuals have what they call anticipatory grief. Mm-hmm. And that's when the individual may find out maybe that a family member or someone has a illness that may lead to death. And so they're grieving. No one is left yet, but they're anticipating that death to come. So that's 2 that I'm very familiar with when it comes to the different types of grief.
Oh, when I think of grief too, there's the loss of sense of self. Mm-hmm. We can grieve that. Mm-hmm. There is also the loss of a job, the loss of a routine or something that's familiar to you, transitioning, moving.
Oh, yeah.
Change. Yeah. Creates grief, which is normal, but we don't typically see, transitions in that sense that I'm grieving, because you move, let's say you move for your job and you find yourself depressed and you find yourself down and you don't know what's going on. It's like, this should be a happy occasion. Like you've gotten elevated or whatever in your job and you just do not feel it. You're feeling really down. You're grieving.
Right.
You're grieving what was normal to you. That normalized life, that change is no longer the same. So those are the different things that I've seen when it comes to grief in my practice.
Yeah, I've seen definitely the career transitions, individuals transition from the military to civilian life, also with divorce and just journals, the ending of a relationship. That's a loss that could lead to grief as well. And I would even say transitions within a job.
Yeah.
So, for example, for counseling professionals, you're the student. you know what I mean? And then you're transitioning, you know what I mean, into whatever agency,
Right.
you know what I mean, you're moving to. So the transition could potentially be a grief, could show up as grief in that process too. Yeah.
Wow.
You know, it's you mentioned it, and especially in, you know, relational work that I also love to do. If I can kind of make it sense, make it plain. There are a lot of individuals, like you were mentioning, that are in relationship or they're in a marriage for a long time and they get divorced. And a lot of people do not realize that, like you were saying, that's grief. So they do not take the time to grieve that relationship, grieve that divorce. It could be a friendship. Like you were best friends with someone for years, and this, you know, and maybe you all, I hate to use this term, but it kind of makes sense. You grew apart. One is growing, one is trying to become a better version, the other is trying to stay stagnant, you know, and not trying to stay, but just remain stagnant.
Yeah.
And so we see that a lot in marriages and when dealing with couples. It could also be the life cycles. So you have your children, these are your babies, you love them, and next thing you know, they graduate. And then all the kids leave the house. So empty nesters. A lot of people are empty nesters. So that is a kind of a sense of a grief. So we often always think of grief as just death. No, the people are still living. It's just that they have, especially our children, and speaking about life cycles, they just cycle on to the next phase of their life.
Yeah.
It could be, like you were saying, on a job. I've worked this job for so many years. 30 years is what it used to be before you used to get a retirement check. That don't happen anymore. But you work a job for 30 years, or you were in the military for 20 plus years. But that was your identity.
Yeah.
Just like you were saying. Now all of a sudden it's like, wait, I get a retirement check. If you're in the military, you get TRICARE and, you know, health benefits and a nice retirement ID card, but who am I?
Yeah.
Because I've been a soldier, or I've been, you know, a wife. If you're married, I've been a husband for all this time. And I've been a mother. I've been a wife and a mother, and all I know how to do is be here for these kids and everybody else. And then that falls in her wheelhouse. Who am I? Because my identity was what we call in the counseling term, so enmeshed with my children. Or if you're a wife and say you have a husband that says, I work, I want you to take care of the home, I want you to take care of the kids. And I've met so many women, and I understand the word of God, Rachel's Woodhouse. The word of God says we're no longer two with one flesh when you get married. But it's like, because I don't have an identity of my own, not her, she has an identity, but an identity, that's her specialty. That's why I'm pointing everyone at the table. I don't have identity of my own, that I often say, are this, we this. When we got our degree, for those who were in the military, y'all understand this one. You had a military spouse that she didn't have nothing else to do. God bless your heart, because I was one, so I'm not talking about you. But she wore her husband's rank. Oh, we know this in the military. I tell you what to do because my husband is this rank. And what did we say? That, well, those are sirs. That's your husband.
Yeah.
So it is so much. Like I just threw on the table. Sorry.
Let's talk about this. I mean, right now, where we are right now, there's the collective grief.
Yeah.
Like this war that's happening, right?
Yes.
Or the pandemic, like the world was grieving,
Right.
the loss, and we are right at the same time. Or if there is secondary grief, right, or secondary, we could be responding from violence, right? What we see on TV, like in our community, if another person of color is, you know, like we get angry, we grieve collectively, and so there's all types of grief.
Yes, I want to say this: grief is not linear. It's continuation. Its continuation can manifest differently over time, potentially altering identity repeatedly.
Absolutely.
I mean, just
Repeatedly.
over time, like you're saying, the pandemic, then now all of these wars and all of the different things, the unrest that we're seeing in our communities, just everything. You're repeatedly being altered, and then people lose that sense of who they are. Who am I? How do I even fit into this? It's so much going on. And I think that's one of the reasons why we have so many people who suffer from anxiety and depression and things like that, because they're trying to find themselves in the midst of all this chaos that's happening, not understanding that they're grieving something that was, what once was, the freedoms maybe that you had to be able to go to the movies and not worry about somebody coming and shooting the movie up, at the bowling alley, or going shopping and not worried about somebody coming in the mall and shooting up the place, because you're grieving what was. And so then people isolate, and we isolated collectively.
Yes, we did.
During the pandemic, and nobody knew what to do with that. Nobody knew.
Yeah.
You know, grief is one of those things in my mind that's very strange. We all react very different to it. And most of the time when people think about grief, they think about a lot of negative things that happen. But I pose a question: can someone grieve because of good things? And I've seen that personally. Yes, I've seen an individual personally, and this individual sat down, talked to me for a long period of time. And basically what was going on in her life is everything was working out, whereas before it was not. So she went through a long period of time in school. She had some problems in school. She was sexually assaulted in school. And when she dropped out, everybody said, you'll never be anything. You're always going to be less than. And then she got her head straight, went to counseling, did all that. Then she graduated at the top of her class, went on to college, graduated at the top of her class there, went into the military through ROTC. And every instructor told her, you're not going to make it. You're a female. You're not supposed to be here. But she excelled at everything that she did till she got to a point where she was like, I don't know what it's like to fail. And she was just constantly sad all the time. And what I had to bring it around to her in layman's terms and say, look at everything that you went through. Now look at the job that you have in the military. And the job that she had was specifically helping women. You may have went through all that to prepare you to help somebody else. And that's when she started telling me, you know what, maybe I shouldn't be sad. And that helped turn her around. So I think sometimes individuals can have a whole lot going for them or not have a lot going for them. And when things turn around, they have a hard time handling that because success is coming too quick. They don't think they deserve it. And it goes back to what Miss Nikki says all the time. She didn't have her sense of her own identity.
Yeah, but even the thing about that, if we be honest with ourselves, I believe a lot of us can relate to that. Because if you grew up, you know what I'm saying? If you grew up, let's say in a challenging environment, if you grew up, one of the things I think we were speaking about before was like trauma. You've seen, because it's something that you just said, and I'm not trying to jump around, but kind of like I think about grief, but then also, and I know people kind of put grief and trauma together, but it's secondary. So I'm trying to think of the term. Come on, I'm here with a whole bunch of counselors. I'm sure y'all can help me. So let's go back to this to try to make sense of what I'm saying. You grew up in an environment that was very challenging. That's what I'm gonna say. Everything was not. You're watching TV and it looked good for the people on the TV, but that's not your reality. Okay. So then it seemed like everything always kept coming against you. Everything, systematically, whatever. If we be honest, it could be more harder for other cultures than some. Okay. But when we bring it to the pandemic and let's talk about the social unrest, we seen a lot of people grieving. We seen, if I could speak for myself, when someone, and this, we're just keeping it real because we go through this. When as a mother of a son of color, it was hard for me, even as a counselor, to hear about another murder. And then in my mind, it's like, oh my God. So it's like, I'm dealing with grief because I can associate with the mother, this crying. Because, and then at the same time thinking, well, what if, God forbid, what if that was mine? What if that was next? So then it's traumatizing me like it's traumatizing her. And we see it repeatedly. And I think sometimes we get so desensitized from it. To where it's like, it's normal. It happens. No, it shouldn't be normal. So we don't allow ourselves to truly grieve because it's become so normalized.
Yeah.
So that's kind of like another form of grief that I don't think too many really think about.
Yeah. You know
So
what?
are-
Oh, I'm
Are you
sorry.
thinking of like vicarious?
There we go. That's what I was thinking about. Yes.
That's exactly what I was
Yes.
saying.
Vicarious trauma, vicarious grief. Yes.
When you say that to normalize it, normalizing the idea that grief can be a lifelong journey, and that's okay.
Yes.
That's the thing. Grief can be a lifelong long thing. Because if you think about it, we've gone through transition after transition after transition.
Yeah.
And so we've been losing a sense of who we are. And even as we evolve as in our identity, we're losing a sense, or we're losing, I don't even want to use the word losing though. We're gaining, but who we were is no longer in existence. So that's transition, right? And so if I'm transitioning constantly, evolving constantly, I'm always in a state of grief. But it's how I see that state of grief.
Right.
Can grief be good?
Oh, it's a natural process that we all go through. So I feel like, yes, it's a natural process that the body goes through.
Of shedding, of releasing.
Yes. Yes. Yes.
It can
Wow.
be good.
It can be good.
So I guess if we're realizing now, right? This is what we do, you all, so we can help. And as we all are speaking, enter into the comments. Enter the comments. Enter what you're thinking, what your thoughts are. So then, if that's the case, that we realize you have grief that's challenging. That's what I'm saying. Grief is good. How do we start accepting that grief can be a good thing? It can help us evolve. We're shedding away. It reminds me of a snake who sheds the skin and you get the new skin. How can we start and help people start, grasping that and processing? Go ahead.
Yeah, let me Google.
Go ahead.
Says
Google.
this. So you say, is there good grief? And I immediately go back and think of Charlie Brown and the Peanuts and all that. He says good grief, but he says it because he's in distress.
Stress.
Yes.
You know what I mean? But can grief be good? And so this is Google. It says good grief includes traveling through the grief cycle without getting stuck or stalled, embracing the messiness and the range of emotions during loss and recovery. And it says leaning into the pain of loss and learning more about yourself and others.
Google
Wow.
is good. Listen. And that goes right into what I was saying. Educate yourself.
Yes.
Education.
Yes.
That's what, oh my God.
Say that first part one more time.
I know, like I'm still trying to process what you read.
Good grief includes traveling through the grief cycle without getting stuck or stalled, embracing the messiness and range of emotions during loss and recovery, leaning into the pain of loss and learning more about yourself and others.
That was music.
Yeah.
You know,
It's like step.
it is. So go through it. Don't get stuck or stagnant. And then it said,
Embrace the
embrace
messiness,
the messiness.
the range of emotions, because you will have a range
So you're
of
That's true.
processing. You're processing.
yeah, during the loss and the recovery.
Recovery.
Yeah. We got to hit on the recovery.
Yes.
piece of it.
Definitely.
And then it says lean into the pain
Lean in.
of loss
Don't go away.
Right.
Lean in.
and learning more about yourself and others.
Yeah.
You know, that kind of reminds me of being in the military. We used to do 12-mile route marches all the time. And they purposely did this. When you did this 12-mile road march, you went out, it was pretty much all flat and you would go downhill. But then when you turn around and come back, it's uphill. And what would they tell you to do? Lean into it.
Lean.
And so I think that is very critical for individuals to understand, is that you have to immerse yourself in the midst of all this grief as you're going through that process, so that you have to feel everything. If you don't feel it, if you're not really deep in it like you need to be, you're going to become stuck. So if you lean in, it gives you more leverage to push your way through to get to the other side of what we know as this grief, where you can experience happiness, joy, where you experience understanding, and you can look back over the road that you traveled and say, that may have been a hard road to travel, but I'm glad I traveled it because now I understand it better. When we travel places, sometimes we don't understand why the GPS took us a certain route, but when you look over and see, oh, there was a big accident over there, you get better understanding that next time I travel that route, I may want to look out for something that's there.
I think about women or men who choose to leave their spouse because it's unhealthy or it's not well for them. I in particular, I have a person in my mind who made the decision to leave their spouse, but then their life got better. Right. So, but that initial stage of leaving is hard.
Yes.
Right. But then you make this choice, right? You kind of lean in, you don't get stuck, you learn more about yourself, and then you learn to live again, right? Like you begin to take care of yourself, you begin to have healthier boundaries, communication. So now if you choose to get in another relationship, you know, you've been through that process. So now I know how to really be a spouse now, or I know how to really, you know, be healthy in any kind of relationship because I've learned. And that's the important part about having good grief.
Yeah.
You said something, Larisha, about the recovery, with us needing to get into talking about the recovery. And the thing that I've written down earlier about effective grief recovery is it's about being heard. And so I know, Shane, like you hit it home every time, get you a therapist, go to therapy, or have that trusted person that you can talk to about it, because effective grief recovery is about being able to speak about what you're feeling, being able to process through that definition that she read about positive grief. This is how we obtain that, right? It's speaking. One other thing, a question that, the book that I talked about in the last segment, and I'll put it up a little later too, about grief recovery is to ask yourself this question: what do you wish had been different, better, or more?
That's a good way to learn.
Yes.
Yeah.
Pause and ask yourself. I know we said about it before, but journaling those questions.
Yeah. So to recover from that grief, because a lot of times going through grief or experiencing those secondary emotions that come along with it, like anger, sadness, and all of those things, a lot of times it's stemming from we didn't feel like we were heard. We didn't feel like what we needed or we received what we needed. So asking yourself that question, what do you wish would have been different, better, or more?
I'm gonna take a stab in the dark at that one personally. I would say what I probably needed more was more time in the recovery room.
Okay.
So, you know, when you have surgery, they give you the anesthesia, they do the operation, all that stuff. Then they move you to a place where you need to be monitored for a while before you go on that healing process. I think in grief, more people need to spend time in recovery. That way they look back at what hurt them.
Right.
They see what has been done to help them. They identify with themselves, and now they're able to move forward. And I think some people try to skip that process and say, oh, I saw the counselor, now I'm here.
Right.
But you didn't take time to recover so your body was ready, or your mind may be ready for that next step. So I think more people need to spend a little bit more time in the recovery.
Oh, yes. That brings me to how we process things, or typically how most people process things, or how we do things. We think and do. We think then do. We don't feel, think and do.
Absolutely.
So feeling through something actually helps with the process of thinking about what is going to be healthy for you, that healthy action.
Right.
When we think, we're not processing, we skip all over how I feel. And it's, well, I gotta be healthy, or I gotta be healed, or I gotta be whole, or I gotta get over this. So I do the necessary actions to help me get over it, but I don't feel through getting over it. I dismiss that I'm still hurt, I'm angry, I'm upset, I don't like this, I'm disappointed. I feel all the emotions, but you can't feel that, because in my mind I'm telling myself, don't feel that.
Right.
Be this. Do this.
Ooh,
You know,
no, go ahead. I'm gonna
it's
get you after that one.
interesting that you say that, because as you were talking, and of course I'm thinking about it from a relational standpoint, I think sometimes if we do feel, the only emotion that we truly allow ourselves to feel is anger. So it's like, I'm thinking I deserve better than this. Then I get angry and then I go and do. So let's bring it down. Y'all know that's what I like to do. So I'm mad because I feel that I deserve to be treated better in this relationship. Now, this is where counseling come in. I don't know how to communicate that. So I get mad. And not am I mad, and I'm not mad at myself because I can't communicate how I feel to you. The only thing I know is you making me mad because you should be treating me better. And then once I get out of this relationship, how many people do y'all know? I'm jumping into the next one.
Yeah.
And then I'm jumping into the next one. So like Kenya was saying, I'm not in a recovery room long enough to sit up and think, what do I need to learn from this? Because even when we are in a sense of grief and pain, what I've learned as I began to mature into an adult, it was a teachable moment. I should have learned something. We don't stay in the recovery room long enough to learn. We just go and repeat the same dysfunctional cycle over and over and over again.
Ooh. It just reminds me of this question that it asks, how many recovered faces do you have?
Oh,
Oh,
and oh gosh, that's a good one. That's a good one.
Yeah, about to make finish.
And so now I'm gonna shift a little bit,
Okay.
and I'm gonna be very specific about this.
Okay.
I said this in the last time we did some recordings, and I gotta speak to the men on this one.
Please do. By all means,
Because
say.
in this area where Nikki was talking about taking that time to feel. Oftentimes men don't get that opportunity for the way that they were raised, what they've been taught. We don't cry, we don't show emotion. And so while we may feel a certain way, that emotion really doesn't sit with us, because the first thing that we want to try to do once we feel something is fix the hurt or the pain that we're feeling or causing to somebody else to gratify that individual, and never taking that time to feel it for ourselves so that we can heal. And that's why we have a lot of damaged men walking around in grief, because their sole idea is to make that wife happy, make the children happy, work hard, provide, protect, and do all this other stuff. But we're not thinking about the feelings that we have and how we have to sustain ourselves emotionally to be able to continue to provide for everybody else.
Damn, I just felt that as a woman too.
But you're right. No, you're
wow,
right.
that's good.
And I said that towards men to try to get it out there, because there's been such a stigma put on men trying to get help when they need it and feel and talk about their feelings. But yes, it can go for women as well. You have a lot of women out there that are carrying the house on their shoulders, and they're trying to cook, clean, do all this and take care of everybody else's emotions. But then when they sit back and go to a room and cry, and everybody, well, what's wrong with mom? Mom needs to have time to breathe and feel as well. So I think that's something that we really need to take on ourselves as men and women, is sit back in the moment and just allow yourself to feel. That way you can identify. Feeling is a good thing. It's one of our senses.
Right.
Some of y'all can go through your house right now, and if they turn the lights out, you can feel your way around and know where you're at. But it will be a shame for you to be by yourself and shut your eyes and not know where you're at.
I feel like this has to be taught to children,
Yes.
people in middle school, kids in high school, when they transition to college. That first year away from your mom and dad.
Yeah.
You're grieving. You know, they say homesick, but you're grieving.
Yeah, that's
the
exactly.
familiarity of your life, right? And so we have to model, men and women, we have to model how to handle the stages of life, right? Because they're not taught. So then when they get to college and they're grieving, what do? They go drink, they go party. Wait.
Put makeup on.
Makeup on. They start, having sex, just wilding out, when instead they didn't acknowledge, I'm grieving. I miss my home. I miss my friends from high school. I miss, home cooked meals, but they cover it up, And I feel like universities need to have space for them to not just acknowledge like, oh, you're going to get homesick. No, give them space and tools on how to grieve well, how to have good grief.
Good grief.
It's good. It is good that you're now separating. It's good that you're now having your sense of identity and self.
Yes, finding yourself.
Yes.
You talked about, you brought up those short-term relief things like the alcohol, drugs, and I just wanted to point out a few more that I think some people might think that that's just who they are, and they're not going through grief or anything like that. And as we have identified, there's many different types of grief, but food, anger, exercise, fantasy, movies, TVs, and books, because it takes you outside of your real world into a fake world.
Wow.
Isolation, sex, shopping, retail therapy, workaholism.
Right. Social media.
Ooh, yes.
Man.
That's something when.
Social media.
In all the areas.
Right. Because it allows you, and then now we have what is virtual reality. So if I'm grieving, if I'm hurting, social media allows me to be somebody that the people around me know is not me.
Yeah.
You know what I'm saying? Now we even got filters. So I can go and put a filter on that thing. You know what I'm saying? We bringing that all out. So you're not really allowing yourself to grieve. You're running from it.
Yeah.
You're running from it and you're masking it with someone else. And then this is the kicker. Then we get mad when we feel like somebody's trying to call us out. When they're actually trying to hurt you, baby, get off of social media for a little bit. Baby, go get you some help. You're doing this because you just came out of this relationship, or your mom or dad just passed away, or you know what I'm saying? You're not where you feel that you should be in life. So you're trying to go and work, which is a question that Kenya and I were talking about not too long ago. Why do people work so hard to be something that they're not? Instead of putting that same energy into the root of what the issue is, so you can get the help and the healing that you need.
Embracing the message.
Because you'll continue on this facade.
Embrace the mess.
Embrace the mess.
Boy, that's going to be a new hashtag.
Listen, let me write that down. Embrace the mess. Okay. Okay.
And, I think one of the things we've said, that even in the first episode that we did on grief, it's one word that's you can pretty much tie into anything that has to do with grief, and that word is loss. And as human beings, we don't deal with loss very well.
Right.
And so as you were talking about the kids going to school, from high school to college, people don't realize there's losses there. Like you said, they're losing their friends. They've been with these kids all through grade school, middle school, things of that nature. And now they're embarking on a whole new world, and they have to start trying to meet friends again. Family is not there. If they have a bad day at school, ain't like they can come home and run to mom and dad and sit down and talk about it. They've got to start dealing with that on their own. A lot of kids haven't been able to do that.
Right.
So I think people have to understand loss at a deeper level, and that will in turn help them to really be able to identify grief and how it's affecting them in their daily lives.
Yeah.
And I think I talked to you all once before about this. This was a little while ago after reading that book about dealing with loss. We've never been taught how to receive anything. We've never been taught how to lose. We've been taught how to receive. So we've only been taught how to receive, not how to lose. And that is not a healthy place to be, because we need balance. There are so many things that we will lose over our lifetime. And so being able to understand how to lose or release, and that's why so many people hold on to so much hurt and pain and discomfort, because they don't know how to release it. And oh my God, the exercises that I do with clients, I do this one exercise where I have them to hold their breath, and I tell them, whenever you're ready to release it, release it. And every time I've asked the client to do that, and I know it's much more, I don't want to get into too much detail on it, but whenever I ask them what it felt like to release, they tell me they struggled to release it. To even take their own breath, knowing that they needed to breathe, they struggled to take that breath because it was like they were proving something to themselves or whatever it was. And I was just like, wow, we've never really been taught how to lose or release things, just how to receive it. I mean, I'm sorry, not how to lose. Yeah, we've never been taught how to lose. We've only been taught how to receive.
That is true. Wow. Now I don't want to stump anyone's thought. If y'all have one, just let me know.
I'm holding on. Go
Look. And if we need to take your thought before we go in this direction, because one of the things that I was thinking about when you were talking about, losing something, grief and stuff, I really wanted to clarify the acronym DABDA.
Okay.
I really wanted to clarify that, because what's happening is, I think, as we were talking about before we came on, people are really trying to help, those who are in the helping professions or helping callings, but what it was designed to do is not what has been expressed, if you will, when it comes to that. So I don't know if we need to go with Rachel's thought first and then go on to Dabda.
Yes.
Okay, go ahead.
You talked about that we don't know how handle loss or lose well, right? We only know how to receive. And I just think about, Christ, and he tells us, like, I used to be afraid of troubles, right? Like, I will be in church, but trouble's gonna come and trouble, I used to be so afraid, right? And so, like, if I feel afraid and I'm my age now, like, and kids may hear, they don't know how to lose well, right? But I just, the scripture that comes to mind, the word says, like, there will be trouble, right? In this world, you will have tribulation.
Right.
Yes.
And I think that's the conversations we have to have with our children, with our college students. You will have hard days. You will have losses. People will leave you. You will be left. There will be some form of transition in your life. And so it says, you will have tribulations, but take heart. But take heart. I have overcome the world. So in that, right, it says you will have many trials. Another translation says you will have many trials and sorrows. We will have it. We cannot run from it.
Right. It's going to happen.
Hence why it's a natural process.
It's
The
natural.
Bible tells us.
But if we hold on to our faith and know that he says, take heart, I have overcome the world.
That's right.
So I overcome those sorrows. I can help you overcome it too. And that's my secure attachment.
The counselors understand that.
She threw that in there.
Yeah. Hey, we gonna learn about that soon, okay? We're learn about how secure attachment.
Yes.
So I know you want to bring up about the stages, the cycles, and whatnot. I want to say this as well before we go there. As long as we believe that someone or something else is responsible, we're unable to recover. We're able to recover from grief if you keep blaming someone else. And this other thing, you can only tell the truth about yourself. When it comes to others, you're only guessing.
That's good.
Yeah, that's a whole meaning in itself. That was deep.
Yes.
I wanted to kind of step on it. That was good.
Out from that grief recovery.
Right. And it's so true. Because in reality, it feels better to blame someone else. Even though we made the decision of whatever it may be, or the choices, or maybe we didn't make the decision because I don't know how to deal with loss. It feels good to blame somebody else. And then I guess my question, because I know we're still down, we'll get there. But my question is this: how many of us connect with someone else in the midst, and y'all, let's see, sorry, just pray for me, in the midst of their foolery that is not really dealing good with loss and grief? Think about even sometimes in our families. I remember posting this question, and it'll make sense in what I'm saying. Sometimes in our family, we'll go along and believe, I'm saying we're family, and we'll believe what Larisha, which she's not like this, is saying about Nikki, because Nikki's not here to speak for herself. But because I don't know how to deal with the fact that Nikki left and joined the military, and she was my sister, and she left me, and I feel a kind of way, but I don't know how to deal with my loss. So I start talking trash about Nikki to the rest of the family.
What do you want to change it to?
So now that we get together as a family or family reunions, Nikki's wondering, why is everybody looking at me like that? Well, what did I do? Well, no, the reality was Larisha was grieving because her sister left and joined the military. She had lost and she didn't know how. So ask yourself, as you're listening to this show, this episode, how many times have you allowed yourself to connect with someone who you don't really know what's going on, but you believe in a word to come against somebody else? And then what do you do when you find out the truth? Do you go back and get it right? Because that's what the word of God tells us to do, Rachel. right? This her wheelhouse. This all of wheelhouse, but this her wheelhouse. Go back and get it right. We don't go back and get it right. We continue to have an attitude with Nikki.
Right.
All because Larisha couldn't experience loss. If y'all just joined us, run that back about 10 seconds. You understand what I'm talking about. So, anywho, that was just a piece with that.
We were kind of having that conversation on the ride.
Listen.
So, in order for us to really heal, you see, we're talking therapy, right? We really, y'all seeing we get into the root of this stuff.
Yeah.
We don't know y'all's business. You know, I say that a lot in another forum. So please don't blame us, as I was just talking about blaming. Ask yourself, why are you like this? Why will you not allow yourself to get to the root and heal?
Yeah.
Yes.
Woo. All right. Wait a minute, you're gonna talk about the model you were just
Yeah.
Yes. So, okay, one of the things we were talking about before we came on here, and it was like, ooh, we need to hit record now. Because we got into a deep level conversation, is that there are a lot of individuals, which I'm grateful for. I know as a therapist, I don't want to speak for all of us, that are trying to help. But there is a model that was created, and a lot of you all, we know as counseling professionals, DAB does the acronym for it. But you all may know it as the stages of grief. So the first thing when someone is grieving is individual may say, well, do you know the stages of grief? And they're quoting these stages. I don't know. Some of it is being quoted incorrectly. So what we want to do is just take a minute to explain why that model was even created in the first place and what those stages are. What was it intended for?
Okay, so you want to hit this off, Ms.
Yeah.
Larisha?
I'll do it. So some time ago, Kubler-Ross developed stages, the 5 stages, as being denial, anger, bargaining, depression, and acceptance. But the key and the tool to remember about this is at the time that this was developed, it was specifically for those who experienced a terminal illness, cancer, and it was the stages that the patient was actually going through versus an individual looking upon that individual preparing for the loss, if that makes sense. And so these stages more applicable to that person that was in the midst of dying.
Yes.
And so what we want to remember is these may not be 100% applicable to us when we lose something, if that makes sense. Still an awesome model to be aware of and to be informed of, but we want to make sure that we're not walking out of here with bad information. All right.
So I guess to kind of continue with that, going into that, we were having a conversation about the denial part and being angry. And so we discussed the fact that while somebody who received a terminal illness diagnosis might be in denial, especially if they're feeling fine in their body, I don't feel what you're saying is my demise that's coming. I feel fine. I feel this. I feel that. And so they're denying or in denial about what's happening within their body. When we lose something or lose someone, we can't deny the fact that it happened, right? So we can't deny that. So there's really not a denial stage. And then becoming angry. The person who's received this diagnosis is angry because they're about to lose whatever life they felt like they still had to live, right? So they're angry with whoever. When you lose somebody or lose something, there might be some emotion of anger, but I don't think that we're angry with the person per se for dying.
Right.
I mean, because you love them, right? You love that person. So I'm not angry with you. And I've had a lot of loss in my family, a lot of close loss in my family. And not one time do I ever remember being angry with them.
Right.
I was tore up, sad, hurt, all of the things, but I wasn't angry at them. How could I be angry at them? Angry at the circumstances
circumstances maybe and how it happened.
Right.
But not angry at that person. So when we're going through and teaching about these stages of grief, we have to be careful on how we're using it, because really there are no stages to grief, because people say it's a continuum, and it is. Grief is a continual process that we go through, like we talked about a little earlier. With if you're evolving, there's going to be many different stages of grief you're going to go through.
Right.
But there's no particular thing to say you're going to first experience denial.
Yes.
Then you're going to be angry. Then you're going to bargain. Then you're going to be depressed. And then you get to acceptance. But the way that it's taught, it's like it takes a long time to get to acceptance, right? So you keep going around in this cycle, and you could feel all of them at one time. You can feel this. There are no particular stages. And I think this is where we get caught up with people saying, okay, it's been this amount of time, you should be over it.
Right.
And there is no time. There is no structured time to grieve. You grieve how you grieve when you grieve. You know, it's not that, oh, okay, well, they've been gone for 3 months, I should be over it. No. If you still feel that loss, grieve that.
That's true.
You've lost the way that your way of living. Let's just say you had an injury, you were a runner, you were an athlete, and no longer able to do the activity that you normally do. That's grief, and you can grieve that with however much time you need. But like we said, in the definition of positive grief, it's not getting stuck or stagnant. Right. In that. So we just wanted to really clear that up. I don't know if y'all have something else y'all want to add to that about grief or about the stages, but we wanted to really clear that up for you all, that there is really no real stages of grief. Now, if y'all want to come at us about that, go do your research about the original stance on that, and then get yourself this grief recovery handbook.
Right.
And see what they got to say about it, because it's a lot of valuable information in this book. It's very helpful. It opened my eyes to a lot of different ways to thinking about grief, because for the longest, not to say that I was stuck on the 5 stages of grief, because I was like, no, I can't teach this. I can't help my clients using this model, because I didn't totally agree with it. And now beforehand, I didn't have that proper information to know why I didn't agree with it until I started doing or digging and doing more research and found out this why you can't ascribe to that. So
that is good.
Do your research, especially for those who are out there who are therapists. And I know y'all like, this is my motto, I'm going with it. Do what you need to do, but just make sure you do your due diligence and research the information that you're giving to your clients. Make sure that you can apply it, it's applicable to you before you teach something to your client.
Right.
And I think that may answer the question that Shannon had asked earlier about why do people, kind of pull other people in to make a point. It's because they're denying themselves. They're in denial. They don't want to come to the reality that my issue is not with a person joining the military. My issue is the fact that I feel that I've lost you. So not recognizing what the real issue is, but trying to pull other people in to make someone else the focal point. They're just in a state of denial.
Right. Yeah, what I'm getting out of this and the last segment that we did is we live. It's a part of life. And when it comes to grief and loss and not being able to process that, we don't realize how we stunt our own growth. We stunt our own. We stay stagnant, like it was talking about. We stay stagnant. We want to stay in the woe is me. We want to stay in the no one understands, because a lot of times when we isolate ourselves, when we're going through, like we were talking about in the last show that we did, is our mind is telling us no one understands what I'm going through. No one can understand. Nobody gets it. Oh, well, how can Rachel understand, God forbid, but how can Rachel understand what I'm going through when her marriage is all perfect, and then my marriage, I'm over here struggling, but we got to pretend like everything's all good because of the position that we hold.
That's a good one.
That's what I'm talking about down, huh? Let the church say. Let the church say.
I have one more thing in mind, but
Look, don't say it. But this is a lot of our reality.
Yeah.
So because I don't know, in that example that I gave, which is fiction, but because I don't know how to deal with loss, that's what it sounds like when it comes to grief. We can't grieve because we don't know how to deal with loss.
Yeah.
That was said so perfectly. But the thing is, when we get on the other side of that thing, When we go and see a counselor, I'm gonna continue to throw that out there. But when we go and see a counselor, when we commit, let me say this. Oh, and I know they feel this all up in their spirits. When we commit to doing the work.
Oh, yes. Oh,
Because guess what we do? What we do. I'm not talking about y'all. I'm talking about what we do, but I'm not really talking about us. So, catch it. But what we do is we go and say, okay, well, I'm going to go and see a counselor, especially if you're in a marriage where neither one of you all want to admit to what the real issue is. So you have a lot of ultimatums. I see this a lot with my clients. Well, no, okay, so why are you all here? This is a question I ask. Why are you all here? And 9 times out of 10, if I could be honest, no knock to bashing on us ladies. The husband will say, well, my wife said I had to come and she's leaving me. But the issue may not even be within the marriage. It may be some childhood stuff that I never dealt with. It may be some childhood loss, some childhood grief that I never probably dealt with that I brought into adulthood. So guess what we do? We'll go and get a counselor for those who are bold enough to step out. I was about to say on faith and really get a counselor. And I'm paying you, counselor, to fix this. I don't want to do no work. That's what I'm paying you for. You're supposed to do the work. That's not how it works. When you commit to counseling because you're sick and tired of being sick and tired and you want things to change, and it hasn't changed in the past 40, 50, 60 years, you also have to be committed to, I don't know what this may look like with this counseling stuff. In my culture growing up, they told us a lot of things. We don't trust people and tell people our business, but I'm sick of this.
yeah.
I'm sick of dealing with this grief and this loss after loss after loss. You have to be committed to doing the work. And that's the first thing I ask my clients before I commit to work with you. Are you willing to do the work? Because you do know it's not about me, right? It's about you.
Right.
And a lot of people are like, oh, now some leave after the 3rd or 4th session. Listen, let me talk about that. Now you didn't experience loss again because you have someone that you committed to as a professional counselor that you didn't went through and signed all this paperwork. I got to talk about it. You committed to, but then you walked away in the 3rd or 4th session. Just say ouch.
And then you dealing with abandonment.
Come on.
And that feeling is, you go through those stages of shock and loss, and ain't like it's a whole nother cycle you go through with abandonment.
Yeah.
And you cause the abandonment.
Oh,
Okay,
come on.
self-inflicted.
Yes.
Self-inflicted.
But then guess what I do? Because I don't want to accept that it was me. I'll blame the counselor. And I'm up here writing bad reviews. Oh, and he was horrible. No. And then so you taint someone else's profession. You taint someone else's because all they want to do is help, but it's not them. It's you.
Do y'all see this cycle? And I know we're about to wrap up, but we're bleeding on each other.
Yes.
Oh my God. Oh my God. Oh my
always
God.
say to y'all?
Yeah.
What do I always say to
Yeah.
y'all? Leave the people. Don't believe them.
Yes.
Even if you're not in a leader, if I'm hurt, if I'm coming to see you,
Yeah.
and then I abandon the relationship, what you just said, then I'm bleeding on her,
Right.
and I'm now bleeding again, and then I'm gonna tell my friend, girl, don't go to counseling, dude, don't go to counseling.
Right.
So now they bleeding. Yes, we just infected.
Infection running.
It's
rampant.
contagious.
So how do we stop that infection? That good grief? How do we really, I guess, tend to the wounds, because we have opened up a lot, right?
Yeah.
Right.
Well, how do we tend to those wounds, those open wounds? Like, okay, I do want to do better. I do want to be different. I don't want to bleed on my friends. I want to be a help and not be a hindrance. How do I do that?
Take grief as good.
There you go.
It's good. It's good. God will not have given us this for nothing. This is a part of life, right? Like when I was trying to pull up the reference of emotions, we have all these emotions, and we're having them for a reason.
Right.
So we got to take it as good. God is good. He's given us this, so it has to be good for us for whatever reason. So we have to do what we all are saying. Go get a counselor, trust, go through that process of building attachment, even though it may be uncomfortable. So we can heal through these different, stages and expressions of grief.
I think we have to just embrace the grief, like you said. A a lot of times when people are experiencing grief, they feel broken. And in order for you to fix a broken bone, what do you have to do? They have to put a brace on it. It has to remain still for a while. Some people need to sit down and quit running from place to place.
Come on.
Wait a minute. Sit down
Somewhere and sit down.
Yes. They need to be able to sit, like we said before, and feel everything that they're going through, and then go to someone that can actually help you. There's nothing wrong with doing first aid, but we got doctors and nurses and counselors all for a different reason. You may be able to apply a bandage to stop the bleeding for the moment, but you got to be willing to go deeper. Somebody's going to have to go in, take that old bandage off. They're going to have to apply some medicine in there. You got to let it sit for a while, clean it out. Bandages need to be changed daily. And you have to do the work for healing to occur. So this ain't something that you go pick up for a minute and put down. No, you got to embrace that thing like you were saying and keep it with you in order to get to the other side.
Right. Dave. And I mean, but you said it before, and I know we are definitely about to close, but you said it before in one of the previous episode shows that we did, is you first have to identify it. You first, because we want to jump from A to C without going through B. And B is where we might have to get off and through there. We have to go through the mud. It's going to be uncomfortable. But when you get to C, and we could talk about it. I'm not trying to talk about it. Let me talk about myself. I could talk about it because I didn't went through it. B was not comfortable at all. But C, once you get to C and then you look back at A and see how far you came. When you see from whence you came, you can breathe because you're no longer in bondage to that grief and that loss.
I love it. I love it. Okay, y'all. Oh my God. This has been an amazing topic. And I know we came at it from so many different angles, giving tips and tools and things that is necessary to help one come and get on that side, the other side of grief, to have good grief.
Good grief.
Have good grief. Real quick, if we can sum up your takeaway from this session, or even just about grief, period, what would that be? And I'll go first. Just something that I want to encourage people to do is to connect with others who are going through a similar journey as you, so that you don't feel isolated, so that you feel heard, and that you can be validated and connect with someone.
Okay.
I'll just end it with a quick quote that I'm reading right here. It says, "Grief never ends, but it changes. It's a passage, not to a place to stay. Grief is not a sign of weakness nor a lack of faith. It is the price of love."
Wow. I will end with saying, allow yourself, as Kenya was saying, to sit in the recovery. Because we get out of something and then we jump into something else, and we do not allow ourselves to sit in the recovery. So make yourself get somewhere and sit down, as we said, and process and sit in the recovery so you can learn. Because all the loss and the grief that we go through is a teachable moment. What are you learning?
Okay. I would just say good grief. Grieve well. But grief can be good for you because it is a release and a rebirth of self.
That's good.
Hashtag embrace the mess.
One hashtag. Come on.
Hashtag
That's
embrace
it.
the mess.
I like that. I like that. Thank you all so much for joining us here at Talk Therapy Heal. We hope that you were able to take something away from this episode that will be very helpful for you in your journey of living life. We encourage you to seek help, get what you need, find the support, but really commit to doing the work. So don't forget, before you end this episode, to hit that like and subscribe button. And don't forget to hit the notification bell so that you'll know that when we post our next video. So we'll see you guys next time here on Talk Therapy Heal.
Bye.
Bye.